My body started hurting. I felt way more fatigued and tired. Started changing colors. She noticed my lips were more pale.
And by noon, when I was called, he was non-responsive. He was in the ICU, essentially in a coma. As a diagnostician of dermatology, I specialize in decoding the mysteries of rare and complex skin conditions. A skin finding may actually be the sign of internal pathology. I'm here to reveal it as your Skintellagent. One of my mentors once said, and it really stuck with me, it's not necessarily what you have to do every day, it's what you have to be prepared to do every day. In medicine, you don't know when the call may come that you're gonna have to pull on something hard deep inside to really remember maybe what you learned 15 or 20 years ago, because someone's life might just depend on it. And I was in my office on a Monday, a typical busy Monday, probably frankly running more behind than I'd like. And I got a call from the hospital, and it was one of the fellows in the ICU telling me that they had just admitted a 20-year-old male who had what they thought was purpura fulminans, which is essentially deep bleeding into the skin in multiple different areas.
We decided to go to the Grand Canyon. It was me, my sister-in-law, my older brother, and my mom. On the way back, where we're leaving, I noticed I was really like cold. I ended up developing chills, and they just weren't stopping. My body started hurting. I felt way more fatigued and tired. We finally got home, so I took some more Tylenol and went to bed. So it wasn't until around like 8 in the morning where my mom woke up to check on me, asked me if I was still feeling the same or better, and I had told her I had felt worse. I started changing colors. She noticed my lips were more pale, and my cheeks were kind of changing color. From then on, we realized that it might be something different. So then, out of mostly like worry and fear, we decided to call 911 just in case.
On the phone call, of course, I'm asking, probing questions, and it turns out that Robert has sickle cell disease, which is unusual in Hispanics. Normally, it's a disease of Black Americans, but he has sickle cell disease, and as a consequence of his sickle cell disease, I was able to pull from this history that he had actually had his spleen removed at the age of 5.
En verdad es difícil contar esta historia, más que nada porque como familias hemos sufrido mucho. Yo me iba con él al hospital y no regresaba a casa hasta que él salía. Él estaba en el hospital, era muy niño, era un bebé. Veía cómo salía el sol, cómo caía la noche en 4 paredes.
I was more specifically diagnosed with sickle cell anemia, so I would always be really low on my blood counts, and I would need a lot of transfusions growing up. But it came to a point where my spleen was absorbing a lot of that blood that I needed for my body, so they decided to take out my spleen. That way it would stop absorbing all that blood.
And many times patients that have sickle cell disease will have what we call a splenectomy, when their spleen has to be removed due to consequences of the sickle cell disease in that organ. But very specifically, the spleen is responsible for a specific way of fighting infections that applies to 3 particular type of bacterial infections. One of those bacterial infections is called Streptococcus pneumoniae, And that can be an infection that's in your sinuses or in your lungs. And if you can't fight it, it can go quickly into your bloodstream. And not only is it rare for that to happen to someone, because it's rare for someone not to have a spleen, but specifically, if somebody has this particular bug, this particular bacteria in their blood, they can exceedingly rarely, and I don't think this is actually really well understood, but we observe this rarely. There's an association between that particular infection in the blood and a clotting disorder that happens called acquired protein C deficiency. And I actually remember when I was in my residency, this is 20 years ago, I was on call and there was a 5-year-old in the pediatric ICU who had purpura fulminans. And we were called in to help. And, as the resident, I'm doing the big, deep digging into the chart and doing the biopsy and getting my attending, to come weigh in on things. And I will never forget my attending, who was the chair of the department, saying, "This is streptococcal sepsis with acquired protein C deficiency." And we saved the kid's life.
I started quickly turning purple from my face, spotting in my chest. My hands were starting to change colors too. It started at the fingertips. The main key point that I do remember was my fingers hurt really bad. It felt like extremely cold. It felt like I had frostbite, but no actual warmth or heat was fixing it. So it was just pretty agonizing, and I couldn't really do anything. But eventually, it just ended up essentially winning over me, and I just ended up losing conscious.
So the next thing I know, I'm finding myself bedside. There's just no doubt this is purpura fulminans. And by noon, when I was called, he was non-responsive. He was in the ICU, essentially in a coma. And, the bruising and bleeding through his skin had started very slightly in the morning, and by the middle of the day had basically encompassed nearly the entirety of his face. So, at that moment, I was fairly certain of the diagnosis. When you lose protein C, when you have this deficiency of protein C, you actually get little clots throughout your blood vessels. And when the blood vessels clot, the rest of the blood vessel, there's no flow. And so that blood vessel basically dissolves, and the blood that was in there just pools right into your skin and in other organ systems. So the blood is not flowing through to organ systems, and you get end organ damage in the form of anoxic injury, which means no oxygen. And those organ systems can actually have irreversible damage.
From when I started gaining consciousness, I don't remember much because it was kind of almost like I was in third person. So I felt pretty groggy. I remember when I first gained consciousness, that's when I met Dr. Ackerman. But even then, I was kind of in and out of it. I was pretty spaced out. So whenever they would talk to me or ask me questions, it felt like really delayed on my end.
So I asked the hospital intensivist, the intensive care physician, to start something called pheresis, where we could basically filter his blood of the clots. And when I returned on Wednesday afternoon to see him, it was quite evident that we had stabilized the disease that had otherwise been progressing. So he was no longer getting additional bruises. We still didn't look perfect, but his old bruises had actually started to resolve. And he had actually said his name. So that was the first responsiveness, wakefulness that he had been able to generate for the hospital team. The nurse had said to me that about an hour prior to me getting there, when she asked his name, he actually iterated his name.
I would say around like day 3, that's when I started gaining more like normalized, and I was able to like actually talk again and conversate and actually understand what was being said and told to me.
A couple of additional days later, on Friday, when I was back to see him, so this is 4 days from the moment we make this diagnosis, we had proof that yes, we were right. The blood cultures had grown strep. The protein C level was very, very low. And at this point, I walked into the room right after he had just finished eating a sandwich. So he was now upright, he was talking, he was eating, and he had really made a miraculous turnaround.
es muy difícil saber por qué te pasan las cosas, pero no nos queda otra más que seguir adelante. Y yo aprendí también a lo largo de estos 20 años que cuando tengas la oportunidad, sé feliz y ama a tus hijos, porque hoy están y mañana no están. Darles lo que les tengas que dar y compartir con ellos los mejores momentos.
Compared to the hospital and everything, I do feel way better, but I'm still like not 100% just yet. I had left the hospital pretty swollen. I couldn't really move. I did leave with a walker, but by now, within like the last 2 days, I had stopped using the walker. So the only issue I have is kind of like my joints hurting every so often. Like they get pretty tired right now.
These are definitely the moments that make practicing medicine meaningful. It's like this crazy privilege to be able to have had the training I've had, the mentorship with Dr. Bo, that moment of her walking in the room and commanding the room when we approached the 5-year-old child together. Um, the frankly, the requisite training that was required of me that, maybe I didn't really appreciate. I certainly didn't appreciate at the time how important all of it was going to be. But when the puzzle pieces all like come together, and you save someone's life, you save the family, it's, the unit. It's like this unbelievable gift.